And now a message from our sponsor, PhRMA. Please welcome Lori Riley, the Chief Operating Officer of PhRMA.
Steve, and thank you to The Hill for sponsoring today's important conversation. Last year, America's unique ecosystem was able to deliver COVID-19 vaccines and therapeutics in record time. But last year, we also learned an important lesson that we have a long way to go to improve our healthcare system for everyone. Work is underway to ensure that medical advances are available and accessible to those that need them. Today, I'm lucky to be joined by Benji Fido. Benji is a caregiver to his son, Antonio, who is 13 years old, who was born premature and today requires treatments and therapies to improve his quality of life. But unfortunately, Benji has faced challenges with insurance that are far too common for many people across our country. So I want to thank Benji for joining us today. And I'd like to start maybe and hear a little bit about Antonio's condition and how Benji and his family have navigated COVID-19 with Antonio. So thank you again, Benji, for joining us. And if you can share a few thoughts on how you've adapted to COVID-19 and a little bit about Antonio's condition as well.
All right. Thank you for having me. It's a pleasure to be here. Antonio, was born 25 weeks gestational, so 25 weeks early. He has a Mickey button, which allows him to eat. The trach was put in November of 2007. We got it taken out, I believe, in 2016. So he has a stoma. He still has the feeding tube. He's missing half of his right lung because there were problems with that. He's had his diaphragm extended. He's had pneumothorax, so he's had chest tubes put in. He's last time he was hospitalized, we're going to knock wood on that, was in 2015, and he had to go back on a ventilator. He does have breathing issues, so he's susceptible to pretty much any respiratory issue. With COVID, it has been interesting. We've had to insulate him a great deal and insulate ourselves with people we're around. At school now, it's when he goes to school, he has to wear a face mask and he wears a gaiter around his throat to protect it. Now it's a face shield when walking the halls. So COVID's made life interesting, to say the least. It with all the safety protocols and everything, like I stated, we don't take him outside of family.
Well, thank you for sharing that. And I'm glad to hear that it sounds like at least you've been able to keep Antonio and your family safe during the pandemic that we've been experiencing over the last year. I was hoping maybe you could talk a little bit about how medical innovation has helped Antonio and improved his life thus far.
Tremendously. If it wasn't for medical innovations, he would not be alive. Advances they've made in helping him to breathe when he was on a concentrator or different pulmonary drugs that he takes, which are numerous, as I stated, because he's missing part of a lung, and it's made his quality of life 1,000 times better. You know, if it wasn't for people working every day in laboratories or different places to try to help him, he would still be on a ventilator concentrator. You know, there's all these innovations happening because of people in laboratories, and it's fantastic, and it helps us, it helps him, and it's going to help him later on in life to be more normal.
And obviously, you know, having the innovations approved and available is really important, but making sure that people can actually access them is really key, right? You know, the best innovation in the world doesn't matter unless you can actually access it as a patient. And I know in the past, you and your family have had challenges being able to access therapies, whether it's insurance coverage or the like. Can you talk maybe a little bit about how important access is for you and your family and for Antonio?
Tremendously important. We've had to fight hard for a lot of stuff that he needs. Nursing, different surgeries that he's had, because insurance feels that, oh, it's not necessary. He doesn't need that, and he does. And it's just banging your head against the wall till somebody hears you, and it's very frustrating. We had a problem with an pre-existing condition this insurance company didn't want to cover. They've been covering it for 13 years. They wanted to stop, and that was just devastating because it's an expensive tool, and I don't have $1,200 a month to pay for that. You rely on insurance. And it's just, oh, he doesn't need it anymore. So I go, no, he needs it or we wouldn't still be getting it. And that needs to change. We need to have easier access without going through prior authorization, without talking to 15 different people before we get the answer we want, not having to write letters and having to call people. It's very frustrating.
Absolutely. I wanted to ask you a question. How does it make you feel? Obviously, there's a lot of talk in Washington and the states these days about potential changes that could be made to our healthcare system. And arguably, some of those changes could make it harder for patients to be able to access therapies they need, or they could do things that may come in the way of progress and innovation, the kinds of treatments or therapies that might be important to Antonio or other patients. How does that make you feel when you hear folks in Washington or in the States are thinking about proposals that might put barriers in place to access or make it harder for some of those innovations that you've relied on to come to be?
Makes me angry because they haven't walked. The old adage is you got to walk a mile in my shoes before you can understand, and they don't understand what it's like when I'm going to go back in time in 2015 when he got really sick and we didn't know what it was about. Just to get him to be put back on the ventilator was a pain. The hospital did it, and then they're like, "Oh, your insurance might not cover it." Huh? Why not? Well, because he hasn't been on it in so long and they feel we're overstepping. No, he needs it. Don't change. He had surgery on his legs. And just to get PT was a trial for that. And if things change, you're going to make it harder. His quality of life is going to suffer. I'm going to be spending more time on the phone. His mother's going to spend more time on the phone. We're going to be more emails, more meetings in person. Don't make it harder. It doesn't need to be made harder. It's hard enough.
Well, unfortunately, I think many people listening and many people across America can empathize with the challenges that you and Antonio have faced, because unfortunately they have faced them too when it comes to accessing care and treatments that they need. I really want to thank you today for sharing your story, Benji, and that of Antonio's with us. I hope you'll give your best to Antonio on our behalf. And thank you for continuing to fight and advocate on behalf of your son. As you described some of the challenges you face today, it's a full-time job providing care to a loved one. And then when you have to face some of the challenges, as you said, dealing with insurance companies, it just makes that burden that much harder. So thank you for doing what you're doing. And it's a big reason why PhRMA released just last week a new proactive agenda to try and address some of the issues that we've talked about today. And there's really three key pieces of that agenda. The first really starts with preparation. How do we ensure that we have robust supply chains in the US? How do we continue to foster collaboration between government and industry and academia, and modernize our research and development and manufacturing capabilities so that we can continue to bring the kinds of innovation that we've seen with COVID-19. But it also begins with affordability and access, ensuring that patients like Antonio can continue to benefit from the rich and robust innovation that our country has brought to bear. It means addressing some of the policy challenges that patients face today. For seniors, it might mean capping their out-of-pocket costs so that they can afford to receive the types of medicines they need. It means lowering cost sharing so that patients cannot not just access innovation, they can afford the innovation, and ensuring that their costs are predictable so that they know what they're going to pay when they show up at the pharmacy counter. And it also means ensuring the rebates and discounts that our industry offers to insurance companies and pharmacy benefit managers make its way back to the patients when they're sitting at the pharmacy counter and not kept by insurance companies and middlemen. And last, it means enhancing equity. We do need to do more to improve diversity in clinical trials, expanding our outreach and education efforts in minority communities, and building a more just and equitable system that recognizes, measures, and promotes better health for all communities. I think medical innovation is an important success story in the US, and it's one that we should never take for granted. And through these common sense solutions, we believe we can work together with lawmakers, both in Washington, DC, and around the country, to ensure that we strengthen our healthcare system and make healthcare, including medicines, more affordable for all. With that, I'll turn it back to you, Steve, and thank you very much for having us today.
Thank you so much, Lori and Benji. It's really great, and I just want to thank Benji for his candor and willingness to share, because we have a lot of these discussions in Washington, but it's so important to think about people who are going through real-world health challenges and how we need to improve things. So thank you so much.